Nurses caring for patients with COVID-19, the disease caused by the novel coronavirus, spend long hours in critical care units tending to people who've been sick for weeks, some of whom hover near death. While infections have dropped in New York, once considered the pandemic's epicenter, coronavirus cases are now soaring in more than 20 states, predominantly in the Sunbelt region. More than 36,000 new coronavirus cases were tallied across the U.S. on Wednesday alone, the highest single-day total recorded yet. 3 nurses in states that have reopened told Insider what their jobs are like as hospitals brace for a possible onslaught of new patients. Lindsey Medeiros. Courtesy of Lindsey MedeirosLindsey Medeiros is an ICU nurse at Banner University Medical Center in Phoenix, Arizona, where lockdowns began easing on May. Work treating the most critical COVID-19 patients has been one of the most trying times of my career, Medeiros said. She continued, "For me, this has just been unlike anything else," she said. "It's very hard to be with a patient by themselves as they emerge from a coma and you're standing over them with a shield and a mask. You're looking at them when they're looking at you, and you can see into their soul. And they're looking at you wondering, what the heck is going on? And I have to say, I'm Lindsey, I'm your nurse. It's okay, I'm here with you. I'm wearing all of this protection because you have coronavirus, but we're taking care of you." And the patient, they look at you and their eyes get big and then squeeze your hand. These people are absolutely terrified. The mother of 2 young girls, Medeiros said she's afraid, too. "When people ask what their mommy does, they say, she's a hero, which makes me cry every single time I leave, but they are just my light in my world and they're keeping me sane," she said. While Medeiros fears contracting the virus, she said she has a fire in my belly to take care of these patients. "Every day I go to work, I perform the proper protocols, I wear my PPE, I wash my hands, and I do my very best to prevent the spread," she said. "That's no guarantee that I'm not going to get it. At this point, it's just not something that I can focus on because of all of the work we have to do to take care of our patients." Some patients admitted to Medeiros's ICU before Arizona eased lockdowns are still on ventilators, she said. "You put yourself in that position and you say, this could be me." In Arizona, COVID-19 infections have soared to almost 60,000, and more than 460 patients have died, according to the Arizona Department of Health Services. Banner UMC has seen an influx of COVID-19 patients since Memorial Day weekend, 2 weeks after the state reopened, according to a hospital spokesperson. While there are still some ventilators available, external lung machines reserved for their most critical patients are at capacity.